How are you today? Good afternoon. This is Coach Eli. Good afternoon, everyone. How is everyone doing? I'm excited to be here with you all. It's a brand new week, meaning that we have brand new chance to make things right, brand new opportunity to tap into. Okay, anything new should be grabbed preciously. I am excited to be here with you all today. What I would like to do is, I was actually going live. I went live, but then I had an issue with connection, so that's why I'm coming back here, just to provide clarity on how on things that are very pertinent in this industry. Okay. Also, I will be monitoring my chat. I'm just trying to buy time to see if anyone will join me. All right. Yeah. So refer to this video at any point. If you have questions, drop it in the comment, and I can help you with that. What I want to talk about today is going to be strictly about non-DOT. The reason is because although non-DOT is not regulated, meaning that it is a non-regulated type of test. When we say it is non-regulated, we're trying to say what it means is that Department of Transportation does not have a specification. They don't deal with that. There is no specification. It does not mean, I don't want you to take it for the other one. It does not mean that you don't have to follow rules or guidelines. DOT meaning Department of Transportation, and non-DOT meaning the other people that does not fall under the Department of Transportation. It doesn't mean the test is not regulated or the test does not have standards or requirements. It just simply means that those people that are going to be doing those type of tests do not fall under the Department of Transportation. That's simple. Now let's go in details. Let's expatiate more on what is required of you. If you are into drug testing business and you are doing non-DOT, now a little bit breakdown. Thank you, Ira. Go back to your room. Close my door. A little bit breakdown. We have lab-based non-DOT, meaning that, remember, for DOT, all of your testing, all of your specimen collection do have to go through the lab. It is lab-based. We also have a non-DOT, which is also lab-based. You can do non-DOT and also send it to the lab. And that is per the employer. The employer will tell you how they want you to do the non-DOT. But for DOT, nobody tells you what to do. You're trained, you're already certified, you already know what to do. For DOT, meaning those that falls under the Department of Transportation, you have to do everything. You have to collect your specimen, complete your CCF form, send it to the lab for the lab review and the MRO review, all of those type of stuff. It's standard. It's also the same for non-DOT. Non-DOT, however, splits into two parts or into two ways that you can do that test. If you're doing non-DOT, okay, you can either do a lab-based non-DOT or do a in-house non-DOT, okay? In-house will be considered rapid, instant, point of care, manufacturer. These are all interchangeable terms for non-DOT inside of the house, in your office, office-based or mobile. All right, mobile can fall under different categories. We're gonna go in depth if I have time on that. Mobile simply is just you commuting to the place. It's just like a mobile means of, transportation of means, like you're mobile, you're going to that person, unlike when the person comes to you. So let's not deviate from the topic of today. So when you are performing a lab-based non-DOT, it means that you can do as many panel as you want, meaning that you can do more than 5 standard DOT panel. You can either decide to do 5 panel non-DOT, or 7 or 9 or 10. A lot of people chooses to do 10, from especially in the staffing agencies, they do 7 to 10 panel. So we have 7, we have 9, we have 10, we have 12, we have 18, and up like that for non-DOT. But for DOT, it's going to be 5 split collection, lab-based, MRO-based, MRO review. You can't change anything to that. But for non-DOT, you can either decide to do it, make it a lab-based, or send it to the do in-house test, do as many panel as you want. Okay, so that's that. I hope that is clear enough. If you're still unclear, drop me a comment. I'm gonna provide clarification. Now, I posted something and it's been going around and a lot of people are confused. The reason you want to obtain your CLIA certification for the non-DOT instant rapid POC manufacturer test, either of those terms, the reason you want to obtain your CLIA certification is because you are collecting that urine specimen. Remember, it's from the body, it's from the human. You're collecting that specimen and you're giving results. You're interpreting that result. You're interpreting that specimen. You can't do that by law if you don't have CLIA. Be very careful. That's why we say set up your lab correctly, so that when there is time for evaluation, time for visitation, time for all of these things, anything can happen at any time. You want to start set up correctly. You don't want to do things that are not accordingly. You're dealing with human specimen. You have to be careful. And that's why we have the CLIA waiver. The instant drug test falls under a waiver test because it's a manufacturer test. You can test right there and you are able to interpret the results right there. So that's the reason you want to obtain your CLIA certification. I see in so many groups, a lot of people, they are not versatile, they are not acquainted, they are not knowledgeable about what they're saying. I've read it, it's not from 1, it's not from 2, but my responsibility is to come in my own group to provide clarity. That's the best that I can do as a coach. So if you're doing non-DOT specimen collection and you're giving the test in the house, you have to have a CLIA certification to back up your procedures, because per CLIA standard, it's the waiver certification is for those that are collecting human specimen for interpretation, for diagnosis, for treatment purposes. So we fall under those categories. The only way that you can skip that is if you're collecting that specimen and you're doing nothing with that, you're just sending to the lab, then you don't require CLIA. But if you're in that office space, or if you're in that mobile area space, wherever you are collecting human specimen, and you're telling that person, the donor, that hey, you're test positive, or you're positive for THC, or your marijuana, whatever came up this way, you're interpreting those things that you collect, you have to be binded by CLIA. So that's what I want to provide clarity on. That's for the non-DOT, okay? But for every other thing DOT, of course, you know it's regulated. You have to take it to the lab. You can't do anything to that. And also, just so you all know, we also have a non-DOT lab-based collection. Those that are non-DOT are those that falls outside of the Department of Transportation. For example, staffing agency, Amazon driver, hospital employees, mention. Y'all know them. So like someone like us, if you're not driving, if you're not through the FMCSA, and we have, let me just simply pull out my CCF form, and if you have a CCF form, you can refer to this. I just want to quickly state the departments that falls under the DOT, and if I happen to have a CCF form here, that would be great. I know some on top of my head, but I want to just go ahead and state all of the agencies that falls under the DOT. I don't have a CCF form here, and I usually carry my CCF forms. I don't have any. Did I move myself? Anyway, definitely we have the FMCSA, we have the FAA as the aviation, we have the HHS, we have about 6 to 7 of them, of these agencies that falls under DOT. So when I teach the course, I always go in details over these agencies, so you can quickly recognize the agencies that are for DOT, just so in case the authorization form is not completed enough, you can quickly refer to them. And so all of your collections are not always DOT. All right, guys, especially if you're collecting, if you're doing like if you have e-screen, foam fax. As a matter of fact, majority of these collections, they are not actually Department of Transportation. So just know, and it's always there for clarity. And for non-DOT, it's always going to be single collection. All right, we also have some non-DOTs that are splits. Again, splits, 10 out of 10 times it is DOT. But for non-DOT, the employer gets to decide what they want, okay? But most times for non-DOT, lab-based, it's always single collection. And at that point, you're required to only collect 30 ml. When I teach the course, again, I have all of these details captured in that course. What I'll do, and actually I have that information in the group already, where I have a specific guidelines or quick facts about drug testing. I have one on CLIA, and I actually have one on DOT, non-DOT. What I'll do in the future is take my time to list just the same way that I have it for CLIA, and I actually pin it in the group. I'm also going to do the same for DOT. It's actually a form, it's a Word document, but I would extract those information and I'll write it out and I'll itemize just the same way I've itemized the one for CLIA. I will go ahead and itemize the one for DOT. What is expected, the quick facts like expectation. I also want to quickly reiterate that we can offer mobile lab services. Okay, we have a lot of people, actually their business is strictly mobile. So mobile lab is in existence and it is an actual lucrative, profitable business. So if you want to, if that's the route that you want to go, I think it's great. You can decide to do mobile lab. It's a business. A lot of people, their business is actually whatever mobile lab. So meaning that you're taking the lab to the people that you're serving, okay? So but then don't say because you're a mobile lab you're not following guidelines or you're not doing the appropriate things, because in this field we do DOT, we do non-DOT, and we also do CLIA. The good thing about CLIA is that it allows you to perform multiple tests, not just drug test or not just instant drug test. It also allows you to do all forms of waiver tests. Remember, we have different kinds of CLIA lab. We have the CLIA waiver lab, we have the CLIA moderate lab, and we have the CLIA high complexity lab. The one that we are talking about, the one that we are operating under, is the CLIA waiver, meaning that less risk. There is no too many risks. You don't necessarily have to have machine or all those things to help you process your specimen. High complexity lab, they're the ones that needs those moderate, needs the high complexity or needs the equipment. That's the word I was looking for. They are the ones that needs the equipment. But for CLIA waivered, everything is in the policies and procedure. And you have to follow everything per the manufacturer. Every manufacturer test has a procedure in them. There are standard instructions. For example, pregnancy test. Before you do let's just use that. That's the most basic one. that is very explanatory. If you go to dollar store and you purchase a pregnancy kit, you would open the kit. There should be a leaflet. It's called pamphlet. The British would call that. That's actually a pamphlet. I was raised. I'm from Nigeria. Okay, so like we are raised by the Britons, and it's called a pamphlet. Okay, so that pamphlet should have all of the instructions from A. You would see A, do this, take out the tube, do this, and it's the same thing for COVID test. Let's COVID test also. So all of those type of tests that are manufacturer based has every procedure in them. Every kit comes with that, and that's what we do when we say we're a lab. That's what we are operating under. Now, so the good news about CLIA Lab is that, or a CLIA waiver certificate, all right, let's start using that correct terms, because a lot of times these terms are confusing. So for CLIA waivered lab, you're performing waiver test, and the good news is that you don't necessarily have to only do rapid drug test. You can go ahead and it allows you to offer other tests that are waivered, and we have a huge long list of waiver tests that you can perform. You don't want to complicate yourself. You want to like keep it simple, especially if you're starting and you're just launching. And that's why I asked how many of you are launching, how many of you need clarity, okay? Because you want to be in a group that will benefit you, and I'm here to provide that clarity to you. There are some tests that you can provide, one of which some are COVID. You can do COVID right there, perform right. Okay, let me say this. Some of this test requires you to have standing order. So if you're not a provider, you want to collaborate with a provider to give you standing orders in order for you to be able to perform some of this waiver test. It's not all waiver tests that can be done. You need a subsidiary. You need to lean on somebody. That's where we have the collaborating physician. So again, there are diverse ways that you can set up your lab. That's why I recommend that you have a business plan and a very systemized strategy set up. Okay, so you're not mistaking things, because guess what? It just only takes that one customer that can mess a lot of things up for you. So you want to be groomed, you want to be versatile, you want to be set up correctly. So for some tests that falls under non-DOT are the ones that need standard test. We can do another video just so I can break that down. But like for example, COVID test, you need a standing order for COVID test. And again, this begins to get more complicated. In some states, some regulations, some requirements are different. Okay, in some states you can use a bigger body of doctors to do your standing order. In some states you need a standing order even to do those tests. All right, pregnancy does not fall under that. No, you don't need a standing order to do pregnancy test, but you need a standing order to do A1C test. You need a standing order to do STD, STI, UTI test. All right, you need a standing order to do COVID test. However, all of these tests, they are all waiver tests. Flu, strep, all of these are all waiver, because you can do that test right there, collect that specimen wherever you want to collect. You want to do buccal swab, you want to do nose swab, you want to do ear swab, you want to do urine, you want to do blood. Blood you have to actually take to high complexity lab. So when you begin to collect all of the specimen, some falls that you have to have a standing order, some you don't. So be careful of how many. So to go the route, some, if you, I recommend that if you're starting to identify which one needs a standing order, identify which ones don't, so that when you're planning, you're not spending too much money for startup. Because if you're quickly heading towards that route, you then need to collaborate. That means you would have to pay a provider to be on your team, and that provider will only just be doing standing orders. And then if you have a provider, it also gives you room for what? Expansion, right? If you have a provider that you're paying, why not go ahead and do more stuff with that provider? Again, it depends on how you want to run your lab. So there are so many room for growth, room for opportunity, room to explore, room to diversify, room to be great. All right, room as an entrepreneur. That's what you choose to be. So I say lab industry, medical field have come to stay. There are so many things that you can do within this business. It is profitable, and that's where the term, the word, this industry, that's why I said this business is profitable. It just depends on who you are, what you want to do, and how you want to do those things. Okay, it's that simple. Again, people, some, like, we also have phlebotomy, we have blood draw. There are so many ways you can connect just by you knowing how to draw blood, you being certified, nationally board certified as a phlebotomist. You can go ahead and network, partner with these doctors' offices, partner with home health aides, like home group homes, nursing homes, all of these homes that are taking care of people, that they have patients in little subsets. You can be that provider. You can be the one to provide and draw their blood and send that blood through your lab, or go to the hospital, drop it off, and you make money that way. Again, so there are so many layers. We have phlebotomists, we have this, we have that, we have the collaboration phase, we have just the manufacturer phase, we have drug testing. There are so many ways you can make money. Okay, and that's why you see a lot of people, some decide to only collect for drug tests. Again, that would be, I've always said this. I don't know how much time you dedicate in watching my videos, but then for drug testing business, you don't just want to do we also have collection only. Just because you're being certified as a DOT specimen collector, that certification is not only for you to collect specimen for people, it actually allows you to run your own drug testing lab. So again, some people, it doesn't matter how you want to do your lab, but some collect for people. All they do is collect. They only get paid by collection. That's what that means. Or some people, they facilitate the process, they hustle, make it a brand on their own, and get their contract. Once they have the contract, they be the one to determine the fee, do everything accordingly, and they get the money. Why some people would rather just relax and collect for people. Again, it depends on how you want to run your lab. So there is no right or wrong answer. We are just only able to determine, hey, this is more profitable, this is more lucrative, this is this. And again, everything also boils down with your area, your location. Okay, I've come to realize I am located in Maryland. All right, guys, Maryland, actually, in my state, we don't, a lot of people don't use form facts. Form facts, if you have form facts, you ain't gonna eat here if you're only a collector. E-screen is more e-screen is the one that a lot of employers uses the most, and I have both, but then I didn't know, but I was able to know because it's being tested. I know because I'm in the business. Let's just keep it simple that way. Oh. So that's what I'm trying to get at. Okay, I was gonna say something else for the, and yes, I had a great question. Somebody asked if, and I think I already said that, if you're collecting and it's non-DOT, you're just collecting, you're not interpreting or giving out results, you don't need a CLIA for that. Just take your specimen, collect it, and send it to where it needs to go. But the moment you're giving them an instant cup, and you're asking them to urinate to give you a specimen, and you're taking that responsibility on your own to interpret that result, all right, you have to have a licensure to back it up. Another question that came in mind that somebody also asked is that, do we need permits? Guys, every state's regulation when it comes to CLIA, unfortunately, is different. That's why we have different and many kinds of answers. Okay, be very careful. Go through your state. There, every state also has the requirements there. It's not a guessing answer. Don't guess. Go through your states. Worst case scenario, email them, give them a call. They have people right there to answer your calls. Because my states, Maryland, requires that when we are applying for the CLIA, we have to also have a doctor by default, and we're gonna get a permit. So we get two things when we apply. We get the lab permit, and we also get the CLIA certificate or the CLIA license. So those two things comes with our CLIA application after approval. Whereas for some states, there is no permit. Florida, Texas, for an example, there is no permit. All right. Whereas Pennsylvania and Maryland, for a fact, I know both states needs permits. All right. So it's just it varies. Okay. So make sure you're acquainted with your lab, with your state's requirements. Then so what I would like to do, I hope this video has been helpful to you. Drop, like, share it, you know. What I like to do is go live and do a Q&A session. So how I want that to work is that I'm going to make a post. All right, I'm going to open a post, and I'm going to leave it there for you all to answer your questions. All right, be it one, be it two, all of those questions are very pertinent and they are very helpful. If not to you, to someone else. You know, we all learn from each other. So go ahead and drop your comments or your questions, and maybe sometimes next week or during my other live session, I will go ahead and answer all of those questions. I'm going to take those questions. All right, that's how we're going to do it for the next one. I hope this video has been helpful to you. Again, like, subscribe, and share. Thank you so much, and have a great one. Bye.